This video forms part of a series of the fit testing process for P2 or N95 disposable respirators. In this video, we'll be using an AccuFIT fit tester device. It is important to refer to the CEC Respiratory Protection Program resources and manufacturer's instructions for use. Before a fit test assessment, confirm the health worker has not had a cigarette, e-cigarette and has not been vaping in the last 30 minutes. During this time, take the opportunity to ensure the health worker is clean-shaven, does not have a hairstyle or adornments that may interfere with the placement of the respirator straps. Confirm if the health worker has completed local consent requirements. Some health workers may feel a level of anxiety about the test. They may not be aware of what the test is for and what is involved. Take this opportunity to provide additional explanations. The health worker should understand the aim of a fit test and be comfortable to perform a fit check. Perform hand hygiene. Respirators will need to have a probe inserted before fit testing. Positioning of a probe may change depending on the make and model of the respirator being fit tested. For all respirators, the probe must be inserted in the zone between where the mouth and nose will sit when the respirator is donned. For most respirators, this zone will be towards the centre of the respirator. Always avoid creases and seams. Take one push nut and one probe from the packaging. Align the push nut and probe in the piercing tool. Select the respirator to be fit tested. Align the centre of the respirator with the probe, avoiding creases and seams on the respirator. Push the two ends of the piercing tool together and release when you hear a click. Remove the respirator from the piercing tool. Inspect the area of the probe for any obvious tears or rips. Select the Fit Test icon from the main menu. Access Person drop-down box and select New. This takes you to the People database portal. Enter the health worker's details and confirm before selecting Save. Select Exit to return to the main menu. Ask the health worker to don the selected respirator. If a health worker normally wears prescription glasses and other PPE such as a head covering and/or a face shield, these items should be worn during the fit test. Remove the HEPA filter and connect the sample line of the twin tube assembly to the respirator probe. Alternatively, connect the respirator to the sample line first, followed by donning. Ask the health worker to perform a fit check and provide guidance as required. Use of a mirror may be beneficial in visualising the respirator fit. If additional support is required, direct the health worker to review the video series Donning and Fit Checking of P2 or N95 respirators in New South Wales healthcare settings. Have the health worker wear the respirator for 5 minutes to establish fit, comfort and to purge any residual particles within the respirator seal. From the menu, select the real-time FitCheck icon to view the fit factor graph. Confirm you have ticked the N95 enabled checkbox. Explain to the health worker the benefit of a real-time FitCheck is to guide the health worker with respirator adjustments and their FitCheck skill. If the real-time FitCheck demonstrates a good seal, the fit factor line will sit at 100 or above on the graph. The respirator has passed the real-time FitCheck demonstrating a good seal. Press Stop, then exit to return to the main menu. If the fit factor line is consistently below 100, the respirator does not pass the real-time FitCheck. You cannot proceed to the fit test. Check the seal of the respirator and confirm there is no interference with the fit. If there is, ask the health worker to readjust the respirator according to the assessment. If the respirator is readjusted, the health worker must re-massage the respirator seal across the bridge of their nose and mould along their cheekbones. Repeat the real-time FitCheck. Where the real-time FitCheck has not been achieved, move to the next available respirator and repeat the process. Respirator selection for fit testing should consider current supply chain availability. Select the Fit Test icon from the main menu. Select the OSHA Fast FFP 2019 option in the Protocol drop-down box. Enter the operator's details according to local procedures. Select the health worker from the drop-down menu and confirm correct selection with the health worker. Select the respirator model and size to be fit tested. Explain to the health worker they will have to perform 4 exercises to simulate normal workplace movements. These movements do not need to be excessive. The health worker cannot talk or laugh during the tests, except when prompted for exercise 2. Use the Fit Test Assessor Guide and direct the health worker through each exercise. Always ask the health worker if they have any questions before starting the fit test. The health worker will need to hold the twin tube assembly during the fit test. Select All Start on the screen. Follow the screen prompts to direct the health worker for each exercise. If the overall fit factor result is equal to or greater than 100, the fit test assessment will achieve a pass. If the respirator seal leaks during any of the exercises, the affected exercise may fail. A failed exercise will show up in red on the screen. Depending on the fit factor reading for each individual exercise, the overall fit test assessment may continue. If the fit test result is below 100, the screen will show a fail. Analyse the test results and reassess the respirator fit. Consider repeating the real-time FitCheck and fit test before moving on to the next respirator option. If the fit test passes, finish the fit test. Following local processes, confirm with the health worker the optimal fitted brand, style and size of the respirator to be donned in the workplace when required. Disconnect the respirator from the twin tube assembly. Perform hand hygiene. Observe the health worker as they doff the respirator and guide them if they are not doffing correctly. The The health worker will dispose of the used respirator in the appropriate waste bin and perform hand hygiene. Results of the health worker's fit test outcomes are recorded in the respiratory fit test form in StaffLink. Refer to local procedures for data entry requirements at your facility. The twin tube assembly and working area must now be cleaned. Refer to video 3 in this series for cleaning.